a year ago, how well did you see this coming? There was some advanced warning. I don't know that anybody, given that we've had Ebola and H1N1 and some of the others, predicted this, but what did we expect, and what did it turn out to be like we expected?
We certainly should have expected it, right? Given some of the things that we've experienced over the last few decades, right? I mean, we had this SARS outbreak back in 2003, right? We have had another coronavirus outbreak as of 2012 with MERS, and thankfully those particular viruses were not as easily transmissible, right? And so the degree of spread that happened with them has not been the same as it's been with this particular virus. But we've always known that coronaviruses can be kind of variable in their contagiousness. And so I don't know. I feel like we probably should have known, particularly, I think Ebola, you mentioned Ebola. I think that's a great example there too, because I think back to when I started as an infectious disease physician in a hospital, if you would have come to our department and said, hey, you know what, guys, you need to have a protocol in place for how to deal with Ebola if it comes to our hospital, right? We would have laughed you out of the room, right? We'd have said, what, are you kidding? Why would we ever need to, now every hospital in the United States has a protocol for how to deal with Ebola if it comes into the hospital, right? Because of what happened a few years ago. And that's kind of the world that we live in now. And I think certainly by January of last year, we were noticing this and we're thinking about it. And it became quite clear that this virus was spreading faster than some of the other coronavirus outbreaks that have happened. And so I think we were anticipating that, yes, we're gonna be seeing it here pretty shortly. And of course we did.
And you, if I remember it right, by early February or maybe by early March, I'm not sure, remember the time frame, Geisinger was actually had established the lab. You guys must have been working on that. And then it took a while for the federal government to allow individual sites, in the nation to do that. But you had a lab early on.
So so our lab, our microbiology lab here at Geisinger was one of 3, I can't remember the exact number, but I think that's right. 3 of the first laboratories in Pennsylvania to be able to test on site for COVID, because of the work that was done.
And was that PCR testing?
Was that still there, Borys?
Yeah, sorry.
You seem to have frozen on me.
Was that PCR testing?
May just take a moment for it to catch up. Hopefully we'll.
Are you can hear me, Matt?
I can. Yep.
Can you hear me now? Can you hear me, Doctor?
Yep, there you go.
Okay.
I can hear you.
Was that PCR testing from the start?
That's right.
Yeah.
That was PCR-based testing to start with, which is still to this day, of course, the primary mechanism for which we diagnose it. Yeah.
So what steps did you have any sense that it was going to get this bad, that you were going to have to adjust what you did in the hospital in terms of treating for patients? Make more room, that kind of thing.
So I'm sorry, you cut out just a little bit there, Borys. You were asking, were we kind of anticipating the number?
Yeah, the number. Were you expecting to have to make adjustments in terms of care, or were you pretty much ready for it?
Right. Yeah. I was, I particularly was dreading that, one of the questions that we kind of struggled with early on was, to what degree was this infection fatal? Okay.
Yeah.
The studies early on are essentially just looking at the tip of the iceberg, and can give you a false sense of what those numbers really are. You know, when you look at the numbers originally out of Wuhan, you know, there was a mortality rate of something like 10%, meaning 1 in every 10 people who had the infection were dying from it. And with how contagious it was, we were all greatly concerned that this was going to have a devastating effect in the country and on healthcare. And yeah, we were really worried that we would not be able to have the capacity to manage this.
What did you know about?
Thankfully,
Yeah. Go ahead. No, go ahead.
I was just gonna say, thankfully that turned out to not be the case, right? That it was not as deadly as we initially thought. Still deadly, of course, but and the measures that we needed to do to kind of restrict the spread of virus were clearly going to be a much bigger challenge for us than were other countries. So I mean, around this time last year, I was very concerned that we were not going to be able to manage it.
What did you know? What did you know about treating the symptoms and treating the disease?
Right. So, you know, at this time last year, we knew nothing about how to treat this virus. Some doctors in China and a few other places had been trying all sorts of different types of medicines, just kind of throwing things at the wall to see what sticks, right? And we didn't know if these things were actually able to work, in part because if you really want to know if a medication's working, you have to do kind of careful, prospective, controlled trials. And we didn't have any of that information to start with. It wasn't until several months later that we were able to start to get a sense of some medications that might help.
So when the first cases came in, what could you do?
Well, we were trying different things. You may recall that Plaquenil, or hydroxychloroquine, was a drug that we were trying to use early on. You know, we were basing that on what we could see in a test tube, right?
Right.
If it seemed to slow the virus down in a test tube, maybe that would work great in a patient. But unfortunately, we've got decades and decades of medicine studies which have shown us that that's not always the
Yeah.
case. And indeed, Plaquenil turned out to do nothing to really help actual people. But we eventually did get some therapies. Remdesivir was the first antiviral therapy, directed antiviral therapy, which we got to be able to treat patients with. And then, of course, the study from the United Kingdom, which came out showing us that steroids, dexamethasone in particular, was effective at kind of treating this disease. And that was a great sigh of relief, because dexamethasone is cheap and plentiful. It's a drug that we use for all sorts of things, and we have lots of, right? And so being able to use that to treat patients was a very nice breath of fresh air.
Were ventilators plentiful enough?
Well, we certainly, that was something that we were having to think about, and like, how many ventilators could we use? How would they be used? Did we really have enough at the end of the day? And we weren't sure. We thought we did, but we wanted more, just like everybody wanted more. We were trying to be thoughtful about how we would use them. Would we have more than one person on a ventilator? Those kinds of things. Fortunately, we never reached the point that we were having to kind of share ventilators or really hit rock bottom with having enough ventilators. We always have had a sufficient supply.
That's good.
Thankfully,
That's unlike some
thankfully, to a lot of forethought.
No, it's unlike some place. That was unlike some places, obviously. Like the,
Yeah, and I think we obviously benefited a little bit by being kind of spread out in throughout the central part of the state and northeast part of the state, as opposed to in a very dense urban area like in Philadelphia or Pittsburgh, where I think they've had, or New York, of course, where there were definite challenges.
because you was able to shift. I think Allison mentioned the other day that you were able to shift resources from the places where you had fewer cases to the places you had more. Yeah.
Exactly.
The face down therapy that came along later. I really don't hear much talk about that, but I understand it became quite important.
Yeah, it is, and it still is used, and we call that proning when we put the patient on their stomach with the ventilator. It helps kind of open up some lung space which otherwise might be compressed and kept kind of closed, if you can follow me here.
It's counterintuitive, isn't it? I said it's counterintuitive, isn't it?
The idea is you're shifting. So when you put the person in the prone position, you don't just put them there and keep them there, right? So you keep them there for a period of time, and then you shift them back, and so you're kind of allowing the dependency of gravity to kind of change in a way to kind of help free up more lung space. And it works very well for the kind of lung injury that happens with COVID. It doesn't happen, it's not always effective for every kind of lung injury, but with the kind that we see with COVID, it does seem to have some benefits in a lot of patients.
Despite the improvements in the treatment and obviously later on the vaccines, we still had a huge surge in cases and deaths over the holidays. Is that basically a matter of there's just we as good as we got at treating the disease, we really couldn't overcome the sheer numbers of spread that happened then?
Yeah, I think the challenge there was the spread of the virus in the community really took off in part because of a lot of misinformation that was put out to people about the value of masking and social distancing. I think people were also just becoming more frustrated with the idea of trying to use measures to prevent the spread of infection, right? And they were sick and tired of wearing masks and social distancing and not being able to do the things that they normally do.
Yeah.
And you can't blame people for being.
I was gonna say, while missing July 4th was one thing, missing Christmas and Thanksgiving is a whole different animal.
Yeah. And you can't. On one hand, you can't blame people for being frustrated, but on the other, there's clearly a correlation with people not following those guidelines with the spread of the virus. No question.
I heard this discussion I was at an estate sale on Saturday, and I really wanted to punch the guy. I heard him saying, look, we had H1N1, we had Ebola, we had all these others. We never heard about them being so serious, and now all of a sudden they're just blowing this one out of proportion. And I'm like, 22,000 dead in Pennsylvania, buddy. There's a bit of a difference.
Yeah, I mean, 500,000 dead in the United States, right. Practically. Well, see, again, this is, I think this is what happens. One of the things I think we've learned, at least I would hope that we've learned, is that when we rely on politicians instead of scientists to kind of help lead the way, we are going to make decisions based on wishes instead of actual facts.
Yeah. Is there any?
And that has a lot of consequences for all of us.
Is there any really doubt that any real doubt that masking helps, that washing your hands helps,
No,
that
in fact,
they know, like
no,
all the things that they told us
we've
to do?
seen. Yeah, in fact, and I think this is something that we've also learned about, as the pandemic was really starting to hit the United States, at the time, if you would have asked me, does wearing a mask in the community, will that help? I was very skeptical that was going to be the case.
There was
'cause
some mixed messaging on that. I said there was some
Right,
mixed
and so
messaging
we
on
saw
that.
there was some mixed messaging, and there was confusion about it, and it wasn't really clear. And we knew in the healthcare setting that a mask was beneficial at preventing spread, but we also knew that wearing a mask for prolonged periods of time also could cause some other problems, at least in terms of theoretical contagiousness and trapping virus and so forth. And so I was skeptical of it, but it became clear through studies, through actual science, right, that actually, yeah, wearing a mask in public had a huge impact on the ability to spread this virus. And now we know definitively that is in fact the case, thanks to a lot of studies, that the masks can play probably the most important role in preventing the spread of this virus.
Are you hear a lot about the variants now? How worried are you about them?
That's a good question. Moderately, mostly because there seems to be so much that we don't really know about them just yet, and there are likely to be new variants that will continue to kind of come down the pike. And so what does that mean for us is not entirely clear. We know that getting vaccinated is going to be critical, even more so in the setting of variants, by helping to reduce the pressure that leads to that kind of evolutionary change in the virus. We've got to have as much immunity as possible in the population. And the only way we're going to do that is through widespread vaccination. So I worry about our ability to do that. I worry about the variants and what that's going to look like, say, a year from now, right?
If the, I mean, I guess the key question is whether or not the variants are going to be treatable with the vaccine, and if they're not, is that going to lead to a whole new pandemic?
Well, we do know that the vaccines do provide some immunity to these variants, right? It depends on which vaccine you're talking about, right? So some of the vaccines are maybe a little bit better at this than others. Yeah. But the key with any vaccine is preventing disease, not necessarily preventing infection, right? And so what's the difference, right? So you can have an infection but not have a disease, right? So if you get an infection, you may have no symptoms, in which case you don't have any disease, or you may have very mild symptoms, or you could have very severe symptoms, right? And we've known forever that the flu shot is very helpful in this way, right? So if you look at the efficacy of the flu shot, it's only about 50, maybe 60% effective at actually preventing infection. So you can get the flu shot and you can still actually get the flu. But if that happens, you are way less likely to get really sick from the flu.
Yeah.
You are much less likely to be hospitalized for the flu. You are much less likely to die from the flu. Mm-hmm. Right? So the vaccine efficacy extends beyond its ability to prevent infection. And so we see that is likely the case with the COVID vaccines and many of these variants, that even if it's not 100% at preventing the infection, it may be going a long way towards preventing disease.
And not only that, if I've been vaccinated and the people around me have been vaccinated, if I have the vaccine, if I have the infection, and I happen to spread it to the people around me, the effect's not going to be the same as if they weren't vaccinated. And that's the idea
Exactly.
that's the whole idea of
And
the vaccine.
the spread is going to be much more stymied. We start to achieve that thing that we call herd immunity, right?
Yeah.
Where we have enough people in the population that have enough immunity that the virus eventually goes away. And we
Yeah.
see this, even with something like flu every year. The problem is that flu, of course, continues to fluctuate every year and change. And that's why every year we have to deal with it again to a certain degree.
I was going to ask that question about the flu. Everybody's noticing how many fewer flu cases there are this year. I just wonder if you could comment on that a little. Is that just people not
Yes.
going out or
Yeah.
masking or what?
Yeah. So this has been one of the nice things that we've seen. We were all worried about what we were calling the possibility of a twin-demic, right?
Yeah,
Where
right.
you're facing both influenza and COVID at the same time. But the strategies that have been put into place, and this is worldwide, have stymied the spread of the flu quite a bit. So we saw this very early on in places like Australia, where being in a different hemisphere, they're experiencing flu at a different time, right? And it was clear that they were not seeing flu to the same degree that they normally do. And it
Okay.
was clearly chalked up to the fact that a lot of people were getting their flu shots and a lot of people were masking and being very conscious about the social distancing. And fortunately, we've seen that phenomena here in the United States this year as well. So I've been very thankful for that.
This will be the last question. How much better do you think we're prepared now for the future, not just for this virus, but other viruses? Obviously, what happened this time around hadn't happened in a century. Now we kind of get sensitized again.
Well, I think I think it's a very, very good question to ask ourselves. When is SARS-CoV-3? Okay. We've had SARS, we've had SARS-CoV-2, right? So when is SARS-CoV-3? Is that 10 years from now? Is that 20 years from now? I don't know, but I think we all realistically can expect that. And I would like to think the one thing we've learned is that if we don't invest in public health measures, that we are going to continue to be susceptible to these kinds of problems. And, we talk about the economic and social devastation that this virus has caused, not just the disease that it's caused, but of course, the only way you can address those things is by preventing the disease in the first place.
So what public health
your
measures?
grandmother was right.
Yeah.
Things like being able to implement widespread testing, being able to implement widespread screening processes and contact isolation measures
Quickly.
And contact tracing measures, as well as vaccine development. Those kinds of measures are what ultimately are going to help us, be strong as a society in the future.
Okay. Thank you. Appreciate all your time. Matt, thanks a lot. I hope we don't have to talk again about this.
Well, if we do, don't worry. Hopefully I'll still be here. Okay.
All right. Thank you. All right.
Thank you.
Thanks, Matt.
Thanks, Borys.
All right. Bye-bye.